Hi Claire, welcome. Could you first of all just tell us a little bit about who you are and what your role is?
Sure, I'm Claire Kofman. I'm from Waverley Care in Glasgow. I'm the senior manager here. Waverley Care is Scotland's HIV and hepatitis C charity. We're working with people, sort of one-to-one work, outreach work, prevention work, testing work, all around HIV and hepatitis C.
Great, thanks. So in Glasgow, we are still in an active outbreak of HIV amongst injecting drug users. So how has your role or the role of Waverley Care changed since the outbreak?
Well, we've been working with people living with hepatitis C one-to-one since 2012. When I came into post in 2015, the number of people that were living with Hep C and HIV, so co-infected as we'd say, was like 1%, 2% of our service users. Then after 2015, that jumped to 10% in a year. And then our prison project that works with people who are being liberated from prison, it's more like 20% upwards. So that was when we became aware of the outbreak and how it was affecting our service. It was just the sheer number of people who were primarily people who inject drugs that were suddenly living with hepatitis C and HIV. And it was, a real spike.
And how does someone living with HIV as well as hepatitis C, what are the added challenges that person might face?
Well, it's the main challenge that we see is more around what do you treat first, when do you treat it, that sort of thing. So hepatitis C is like 100% curable now pretty much, 8 weeks of tablets, but we know at the moment that people, like the NHS, are keener to get people steady on their ARVs, on their HIV medication, and then treat the Hep C. But the people we're working with are leading quite precarious lives, and actually even an 8-week period of stability can be a big ask sometimes. So it seems to be taking longer to treat people's Hep C if they're living with HIV. And it's also, it's a big shock to a lot of people. A lot of people are still remembering the 80s and the tombstones and you're going to die of HIV, and so there's a bit more to overcome, I would say.
So all that fear and misinformation around HIV on top of the 2 diagnoses as well. It's huge for people.
Yeah, and stigma, it can be a lot to take on.
So you mentioned there's stigma as well and misinformation. So what are some of the other key barriers that you think people are facing?
Well, a key barrier that we've found is the people that we're working with are people with a lot of additional health inequalities anyway. They're people who are often homeless or have been homeless, people who are living with trauma in their past, mental health diagnoses, active addiction. They're people that health is not maybe their top priority to them at that point, at a point where they're having to deal with a new diagnosis. So that's a barrier has been actually sort of that getting people to access health services, not because they don't want to, but because they've just got so many other things going on. And so health services, adapting to that has been sort of a way around that, but it's, it could always be something that we could use more of really, to adapt the service to fit the people rather than expect the people to go 2 buses to get to Gart Naval.
Yeah.
That's been a big barrier, as has poverty, general ill health, prison, because people are bouncing in and out of prison. So it's hard to keep people sort of engaged in their care when that's happening. So those have been some of the barriers that we've been facing.
And in terms of, you were mentioning some of the services have been adapting, doing more outreach. What are some of those services that people you're seeing successes with and are really working for the people that you're working with?
Well, definitely the HIV outreach nurses has been something that's been, fantastic. Claire and Lynn are just brilliant at what they do and have really kept people engaged. And it's remarkable, like the knowledge that they have of all the service users that they keep in their head. So we've been working a lot, sort of joint working with the HIV outreach nurses, and I know that people really respond to Claire and Lynn. As well, other services sort of reacting to take up some testing and to put out some messages has been sort of really good for us as well. Because we're sort of here for the HIV and the hepatitis C side of things, but it's good to get referrals in, obviously from other organisations. So people like the Simon Community Hub that are seeing people day to day on the street. we've been able to link in with them here and there to better work for service users, NHS staff more widely, other organisations we've been doing education and testing, like with Turning Point Scotland as well. So those have been working for us because we can then sort of reach the people we need to, but it's also meant that those organisations have been thinking more of bloodborne viruses and things like that, which has been great to sort of do that all-round holistic support for people.
So you've just talked there about the holistic services, more services involved, you're getting more referrals in, there's more outreach happening. What additional types of services do you think is needed for this population to help them engage with testing, treatment, and to stay safe and well?
I think potentially more services for women, because this is a group of the Outbreak is a group of people where there are a disproportionately high number of women for what you would normally see in an HIV outbreak situation. And we're well aware that there's additional barriers with women, things to overcome that are additional and maybe ongoing, such as children being taken into care, sex work, transactional sex, backgrounds of trauma, sexual abuse. I mean, that goes on with the men as well, but the women are often facing these additional barriers that make it quite hard for them to be prioritising their health when they've got all these other things and often other people to care about. So, you know, they need to be focusing on themselves, but their brother's just done this and they need to check that, or they want to still be seeing their kids and they need to engage with social services and something's going on there. And I mean, groups like Tomorrow's Women and the 218 Project, things like that, are wonderful at working with women. But it is something I would say we've maybe seen a bit more. Maybe there needs to be slightly more adjustment of things like sexual health services and that to better fit the women involved in the outbreak.
Okay, thank you. So as a response to the outbreak, Waverley Care is about to launch a new service. So could you tell us a little bit about that?
Sure, yeah. It's in response to what we were seeing with increased numbers of people coming through the door and hearing from service users that they didn't feel they fitted very well anywhere. Like we had a gentleman who's a former person who injected drugs, no longer injecting drugs. That was how he contracted HIV. We sent him along to a group at another organisation, but it was all men who have sex with men in the room, and he just felt like, obviously they weren't excluding him or anything like that, but he felt like he couldn't talk to his experience because he would be like disclosing that he was a former drug user, and then that's something else to come into the mix. So there was no way that he fitted. And with our one-to-one work, I mean, everyone's been it's been more and more difficult to work with people simply because they're living more and more difficult lives. So the new service, the HIV Street Support Project, comes from that, and it's going to be one-to-one work with people who are living with HIV or at risk of HIV, either to get them testing regularly and get them thinking about HIV, challenging some of the stigma that's around there, trying to keep people from becoming newly infected, or it's going to be working with people who are living with HIV to live the better lives they can, the best lives they can. So to better engage with services, or for services to better engage with them so that they can focus more on their health and look at taking small steps towards leading healthier lives. We're well aware that the successes will be quite small, given that these are people that are often street homeless, and obviously there's so much going on in their lives that it's not going to be, 6 months down the line he was volunteering in an HIV peer support project. You know, it's going to be a slower project, which is why we're glad we've got 3-year funding initially to sort of get something underway with that.
Great. So you've got some new workers for it. How would people go about maybe referring in, or how will people find out more about that new service?
Sure. Well, I mean, the new workers started just today. So we have got some things that are up in the air, but I would say initially to just get in touch with Waverley Care in Glasgow and we can work it out until there's a more established pathway. It's not a service where it's like, you need to have been referred by your community addictions team. You know, it's we've always been open referral, and in our Hep C project, about a third of the people that come in are self-referrals, and we're just quite happy for that to continue.
Yeah.
So if people just call in to the Waverley Care Glasgow office, and then we can take it from there.
Excellent.
Yes.
Thank you.
Thank you.
So just want to say thank you, Claire. That was really interesting, and yeah, good luck with the new service.